you have to be careful with the herd immunity. And I think it's often people do misunderstood the herd immunity. They thought, okay, once I get infected, then basically I could simply lie down and go freely without caring at all. This is a complete misunderstanding, because for viral infection, the virus itself is a problem, but also your own immunity also is an issue. So it's a combination. Basically determines how serious you will develop symptoms, clinical outcomes. So we can see clearly that in China, over 90% of the population have received 3 doses of vaccination, so which actually provide tremendous protection in terms of avoiding developing severe diseases. So this definitely will help. But the one thing is that once the virus is mutating very fast, that tells us that you can't totally rely on vaccines and the medicines. You do need to use your common sense and do a certain kind of protection for yourself. So this is something actually we have to carry in mind. The issue here is that if each individual provides some kind of self-protections, you could basically stretch out the peak of the infection, flatten down the curve. So that would ease the burden on the health care system.
I think herd immunity has been a little bit misunderstood or a little bit exaggerated, because herd immunity depends on how infectious the disease is and also whether you can contract it again and again and again. And with many diseases, you really only get it once, or you only get it once severely. Something like measles, for example. Also, in a way, the herd immunity is, it keeps people, healthy people, from dying, but since they're out, they can spread it even more. So it's not something that we can rely on. And I think we really need to start talking about a new normal. You know, we've been saying for a while that, well, COVID is going to become like the flu, but in the next 2 or 3 years, I think we're going to be in a situation that's worse. In regular flu cycles, you know, you get your vaccine and you're pretty much protected and it's not a problem. But I think with COVID, even if people are vaccinated, the virus is evolving so rapidly, as Dr. Wu said, that there isn't as much protection provided by the vaccines. And also, COVID is more infectious than the flu. So we're not getting the type of protection that we have in the flu. So we need to behave a little bit differently. We need to protect ourselves more, and we need to protect our family members and our community more.